Our doctors who use this successfully are having relationships with patients that go on for months or years or even decades.
Welcome to AMC. I'm Dr. Greg Miller. Do you really understand your patients? Today, Dr. Shannon McMurtry is going to explain how the second half of the consultation can specifically address this gap in the doctor-patient relationship. You won't want to miss his pet peeve as a chiropractic mentor. If you enjoy this video, please click the like and subscribe buttons. Let's get started.
Okay, we're going to have one of those tough love conversations. I hope you're ready for it. Do you really understand your patients? Now, before you pop off an answer, I want you to think about that. You're a chiropractor. I'm a chiropractor. We pride ourselves on how we listen to our patients. We consider our patients to be our best source of information about their problem, their condition, what they're dealing with. And we think that that's better than what the allopaths do, what the medical doctors do. It is better, but is it enough? See, that's the question. Have you ever been to a doctor that you felt good about, but you're not sure that they understood what was going on in your life? If you haven't had that experience, let me tell you, that's a very disheartening experience for a patient because they have somebody that they really like, but they're not quite sure this person is on the same page as they are. I've been doing this chiropractic mentorship work for almost 20 years now. And this is a very strong pet peeve of mine because you can do the very best OPQRST in the world and you can talk to your patients about their problems for 24 hours and never really grasp what's going on inside of that patient's body and their life and their fears about the future. And see, that's the part of the equation the patient knows is missing, but will never verbalize. In our system, in the consultation, we have a section in the second half of that consultation where we specifically address this gap in the doctor-patient relationship. Our doctors who use this successfully are having relationships with patients that go on for months or years or even decades. Now, you don't develop that type of relationship with a patient just because you understand their boo-boo or their pain. You don't get that opportunity to see them express full health over that time by just understanding the condition. They are more than just an amalgamation of symptoms and problems that they're delivering to your desk today. They are a real person with real concerns about where they're headed. I want you to think about the patients you're seeing. How many times have you sat down with a patient who's had a problem off and on for years, and now they're in your office? And you think they're motivated because of the pain or the problem, or they're just tired of dealing with it. Bull. You don't understand what's going on because you were never trained to find out what is going on. See, without the understanding, you're missing the relationship, you're missing the opportunity to serve them fully, and you're no better than the allopathic doctors that you hold in disdain. And that's reality. We know how to do that, and we do it successfully, and it's reproducible, and it doesn't matter your technique or your personality or where your clinic is located. You need to know how to do that as well. That's why you need to check into our boot camp and you need to check into our online content, because this is a factor that is missing in 97% of the offices out there. I hope you'll grasp onto this. If you understand that patient's future or that patient's thoughts about their future, you have a full understanding of that patient, not just their problem, not just their condition, not just what they've done, but you understand them emotionally with that problem. And if you're not asking about that, or you don't know how to dig for that information because the patient's tendency is to minimize, then you are missing the boat. Get this information. Use it to develop that long-term relationship that both you want and the patient needs to express full chiropractic health and benefits. I wish you the very best, and I look forward to seeing you at our next meeting.
If this has been helpful, like and subscribe to be notified whenever new videos come out. As always, we're here to help. Text us any questions you have to 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice. See you next week.